Wisp Sports Radio, the voice of women in sport.
Hello and welcome. Thank you for downloading Sound Bites on Wisp Sports. I'm your host, Dr. Kirstin Lauritzen, and this is Season 2, Episode 7. So today we are going to talk all about vitamin B12. Last week we talked about vitamin B9, and we're just going to roll right with these B vitamins. And vitamin B12 and vitamin B9 are actually related in some different types of nutrition and how the body uses them. So that's why we're going to stick with B12 for today. The interesting thing about vitamin B12 is that it's usually really under-tested, especially in athletes, but in just people across the board. And what's interesting about vitamin B12 is that it can actually affect virtually every system and tissue in the body. So it's really one of those vitamins that it's very, very necessary for many functions in the body. So we're going to talk about all of that today, and also how it's going to relate to some of your performance and also recovery. So when we're looking at vitamin B12 and specifically at nutrient deficiencies, there are some symptoms that can come from vitamin B12 in a range of deficiencies. So from like a very, very, what we would call like a level 1 vitamin deficiency to like a level 4. There's a range where, you start to become a little bit deficient to where you're very much so deficient. And so these symptoms are going to kind of range in that. So some of those symptoms would be things like brain fog, anxiety, depression, fatigue, cognitive decline. You might also see things like infertility in both males and females from deficiency in vitamin B12. Also things like autoimmune disease can pop up, heart disease, stroke, and that's partially because vitamin B9, B6, and B12 all manage something called homocysteine, and that can be related to heart disease. So you can see how things are starting to connect here. Also things like learning disabilities, premature aging. There's also symptoms that's really interesting. There's some symptoms that can mirror a condition called multiple sclerosis, or MS. And that's partially because of how vitamin B12 interacts with the nervous system, and we need it for a really healthy nervous system. Also things like Parkinson's and even impaired immune function. So looking at your immune system, you also need vitamin B12. The thing is, and as I mentioned already, is that really with vitamin B12, it's just rarely tested for. And not only that, but the testing for it can sometimes be problematic. So we're going to talk a little bit about that and dive in, because as you try to figure this out for yourself, I want you to be aware of what the testing is like, and then what some of those options are in case you want to go and figure this out for yourself. So one of the most common ones is if you go into your physician's office, they're going to take a serum blood test, which in reality really only picks up a pretty small amount of people who are deficient in vitamin B12. And that's partially because this test looks for the total amount of vitamin B12 in the blood, and it usually only catches it once your deficiency is quite bad. You've been deficient for quite a while, and now it's finally catching up and seeing those deficiencies. But what happens though is that it tends to miss what we would call like a functional B12 deficiency. And this is why I see this a lot more in my practice, because some of the tests that I use we use both serum and urine, and we test for certain markers that are a lot more sensitive to vitamin B12. So we can see it in that wide range, when you first start to become deficient to when it's, you've been deficient for a while. And these sensitive markers, I'm just going to mention a couple of them just so that you're aware of them. But one of them is called methylmalonic acid, and then also homocysteine, which I mentioned before as far as it goes with heart disease. These two markers are a lot more sensitive for vitamin B12. There's also one called, and this is the short version, but it's called HoloTC, and it's really, really sensitive for vitamin B12. And what's great about it is that it can catch those early stages of vitamin B12 deficiency. And so you can use these different markers, and we can see them on tests that test through urine. We can also test them through the serum. And that's one way, or a couple of different ways that you can start to figure out where your levels are, and make sure that if, your symptoms that are starting to pop up might actually be related to a vitamin deficiency like vitamin B12. The other thing too that we can do is, I also want you to remember that when we're looking at labs, and this happens a lot because I have patients come in with their labs and they say, hey, can you read these for me? They'll say, well, they all came back normal from my doctor and I just don't feel normal. Like I have symptoms and they're telling me that these labs are fine. This is one thing that's really important, is that when they are giving you those normal lab ranges, those are there to basically detect disease or the presence of something that just isn't right outside of those ranges. They're not looking for optimal levels of, any of the vitamins and minerals, any of those other things that they test for on your CBCs and chem panels that you have probably had taken at some point in your life. So just keep in mind that when you're looking at those normal lab ranges, they're just looking mostly for disease. They're not looking for the optimal level of what is the best for your body and how much it actually needs in order to function at its best. So the other thing to remember as well is that, and this is just moving into as we get to like how this can specifically relate to athletes, is that remember that when you're looking at also these vitamins and mineral deficiencies, is that it's really a matter of not only absorption in the gut, but it's also about demand, right? So how much does your body need in order to do all the physical and psychological processes, that it does. And this is why it's really, really important to be looking at all of these with athletes and with active individuals, because the demand is going to be potentially a lot higher depending on partially your genetics, but also on the things that you do, and how much you use your body. And then on top of that, there are a couple of things that can happen with the GI tract that can influence absorption. And one of those can be something called SIBO, which is small intestinal bacterial overgrowth, and also low stomach acid. So people who have things like GERD, which would be like heartburn and acid reflux, those are often symptoms of actually having low stomach acid. And when you don't have enough, you're not going to absorb vitamin B12 as efficiently, because there's something that happens in your stomach that helps you to get vitamin B12 out of the foods that you eat. So kind of cool, I think, because it ties in that it's not just your GI tract that's doing a lot of the absorption of minerals. It has a lot to do from you're just where the processes start in your mouth when you start chewing, all the way down to the intestines. So just keep in mind that if you do have some GI stuff going on, that can influence your nutrient deficiencies.
Are you a sportswoman who's considering having a family? You need to tune into Wisp Sports Mum's the Word podcast, where myself, Pamela Ralph-Jones, and my co-host Sarah Newbury-Moore are going to be talking about what it's like to be an athlete and a mom.
Talking specifically about athletes, which is the fun stuff. How does vitamin B12, interact with athletes, and what do you need and why do you need it for sports? So one of the things that they found in a couple of studies is that it's possible that having a deficiency in vitamin B12 can actually decrease the athlete's ability to perform really high intensity exercise. So I think really what they're talking about there is just fatigue, just not being able to really exert yourself as much as maybe you used to. That could be a good sign that there's something just not quite right, and you might want to take a look and see if there's some deficiencies there. But one of the things too about, when we were talking about these optimal levels, we're not just talking about the negatives of having nutrient deficiencies, but one of the benefits of making sure that all of these vitamins and minerals are at their optimal levels is that with especially vitamin B12, athletes had higher levels. So higher levels of vitamin B12 correlate with the enhanced athletic performance. So it's kind of cool because you can actually perform potentially even better if you have optimal levels of vitamin B12. The other thing that you also need vitamin B12 for, which we even mentioned briefly in the previous episode with folate and folic acid, is that you need it for red blood cells. So vitamin B12 can actually help you and help iron and help oxygen bind to your red blood cells so that you can have it available for you whenever you need it. And one of the anemias that comes with B12 is called megaloblastic anemia. And what happens is your red blood cells start to change shape, which means they're not going to be able to bind oxygen as easily. Now, this doesn't really happen in a lot of people, but it is something to be aware of if that is something you might have in your genetics. Also, if you know of somebody that might have that anemia. The other thing too is that vitamin B12 is really helpful for repairing damaged cells and also in repairing tissues. So when we're talking about recovery, you want to make sure you have enough vitamin B12. The other caution I would say as far as vitamin B12 goes is that, and we've talked about this before, but female athletes have a tendency not to eat enough. And so they are at a higher risk of not only vitamin B12 deficiency, but also B9 and also B6, which we will talk about in a later episode. But these deficiencies can often just be because of under eating and not compensating for energy expenditure, right? So the amount that you're putting out and you're using all of that energy, if you're not replacing that with enough from your diet and from food, right? That's where these start to pop up. And females typically are a little bit of higher risk because there's so many factors, right, that go into how female athletes look and how they perform and all of that. So just some things to be aware of when it comes to that. Okay, so the way we always wrap these up is that we talk about where can you get get vitamin B12 from? How can you apply this? So we didn't really touch on this a whole lot, but there is a difference between, people who follow more of a vegetarian and vegan plan versus meat eaters. And I'm going to try to give you some guidance if you're in either category. So for meat eaters, there's a couple of foods that are really awesome for vitamin B12 sources. So liver would be one of them. Getting organ meats they can often be called sweetbreads. They are really high in a lot of different types of vitamins and minerals. So if you can get a really well-sourced liver and also, I guess, figure out how to cook it, which is the reason why most people don't eat liver, and to make it palatable, liver is just so great for a lot of vitamins and minerals. But also, don't worry, it's not just liver. There's things like clams and oysters. If you ate clams or oysters or liver one time a week, that would actually give you enough B12 most likely for an entire week. That's how dense they are with vitamin B12, and that's respectively, right? So there's people who are going to need more or less depending on, again, as we talked about, their needs and how much they use, their physical demand, and also genetics as well. But there are some other sources if none of those, in like seafood and all of that isn't really for you. You can get them from fish eggs. B12, you can get it from fish eggs. You can get them from beef, from lamb, from eggs are also okay sources, but they're just not as dense with vitamin B12. And so again, if you ate like clams once a week, and you can get them, or oysters, you can get them in like sardine tins and cans. There's some options there. But anyway, so those are some great sources for meat eaters. Then also for vegetarians and vegans, this is where it gets a little bit trickier, and you're really good. I cannot stress enough just supplementing with vitamin B12 and finding a very good quality supplement, because it's actually a misconception that foods like seaweed, fermented soy, there's also spirulina, and I think they even have said that brewer's yeast are good sources of vitamin B12. The issue is that it's actually how the makeup of what they say like vitamin B12 in these foods is what happens is they actually they contain something that's similar to vitamin B12 that's called a cobamide. And that actually, so what's interesting is when you take that in, that blocks the intake of vitamin B12. And so it then increases even more of a need for vitamin B12. So the point of this isn't to say don't eat a vegetarian and vegan diet. There's so many benefits to those types of food ways of eating. They are usually very high in vegetables and fruits, which I cannot stress more. It's so important. But if you aren't eating meat, which is one of the best sources of vitamin B12, then I cannot stress enough, please supplement. That's the best thing I can say. So, and if you're really, really concerned, consider getting tests that are a little bit more functional and a little bit more sensitive to the possibility that vitamin B12 could be a deficiency for you. And then you can actually see what you need and see if it even relates, to how you're performing or feeling or anything like that. So that's our episode for now. You'll be able to see links to the references on wispsports.com. Please make sure to follow Wisp Sports on all social media channels, and make sure to share this episode with anyone you think might need to hear it or would like to hear it. You can also follow me at Dr. Kirstin on Facebook and Instagram, and drkirstin.com. If you'd like to reach us with any comments or questions about this episode, you can at info@wispsports.com. You can always leave a direct message with us over on social media as well. Thank you for listening, and I will be back in a few weeks with another breakdown of a specific vitamin or mineral.